by expressing our gratitude to our Dr. Gibbons and our colleagues at NHLBI who have convened this meeting and have led this AMP program with this particular public-private partnership related to the challenges of heart failure, particularly heart failure with preserved ejection fraction. And this meeting represents an opportunity to actually celebrate the launch and progress toward important milestones of accomplishment that the collaborative team and ecosystem has achieved collectively as we pursue this exciting endeavor together and reflect on that progress, as well as plan and anticipate execution of our approaches moving forward as part of this collaborative collective effort. Indeed, we're delighted and excited by this convening because we're tackling a very vexing clinical problem of heart failure with preserved ejection fraction, which everyone in this meeting recognizes is a compelling problem, both in its understanding of its pathobiology, its appreciation of its clinical pleiotropy, and the need to really almost deconstruct the definition and taxonomy of heart failure, and a recognition that for a disorder, it's almost syndromic in the nature of its presentation, requires a step back to fully appreciate the drivers that are likely to be multiple in its etiologies in the clinical spectrum, and to really bring us all together for tackling such a vexing problem, which no one entity could probably do alone. And that's where we're excited by the convening of FNIH of this public-private partnership, where all the elements of the ecosystem can lean in with their particular expertise to help us make progress. Clearly, this is an area of important unmet need, of size and scale, and importance to the healthcare system, and most importantly, the high morbidity, mortality, and suffering that patients with this condition are bearing. And that's where this vexing problem not only presents a challenge, but what I believe is an exciting opportunity to make a major difference in public health impact if we can work together as a collective ecosystem partnership. And so indeed, that's where we think the AMP platform is ideally suited toward this effort. And again, want to give our appreciation for FNIH in its leadership in bringing us together, both the industry partners who have shown great leaning of their expertise and perspective and willingness to co-invest with us to try to address this problem, advance the science, and promote the translation into patient impact that could not otherwise happen with one partner alone. And so we appreciate that this also builds upon the foundational investment that NHLBI has made in this area that's captured in our HeartShare program that is also obviously a key part of this meeting. And we think lays a framework to establish that molecular atlas of the failing heart that also leverages at scale our longitudinal community-based cohorts, as well as a prospective cohort with our academic partners at our specialty centers that will do that deep clinical phenotyping and characterization. Indeed, we're also appreciative as part of this AMP of the partnership that not only extend to industry, but incorporate our ongoing academic partners, clinicians on the front lines, as well as patients in this total collaborative effort that includes also non-industry partners such as the American Heart Association, Heart Failure Society, and others. It's again part of this all hands on deck of this ecosystem to address this complex problem. And indeed, you have a great agenda of work cut out for this meeting, in which we hope that we'll bring together the various assets that the partners bring to the table. I believe we're excited by the opportunity to take advantage of some of the assets of the NHLBI, which is our top med program, our precision medicine program with over 150,000 whole genomes, inclusive of phenotypes relevant to addressing this with multi-omic characterization embedded within those longitudinal cohorts that we think will be, again, a foundational pillar of this AMP program. And indeed, the data science and data science resources that are based within the NHLBI Biodata Catalyst that again provides not only a repository but a multi-dimensional workspace that will facilitate the characterization and dissection of heart failure with preserved ejection fraction. And these are assets that we continue to add to, inclusive of leading edge work that we hope to see in capturing imaging technologies of a variety of sorts that again will be hopefully machine readable and leverage the machine learning and AI capability at scale that this sort of program can leverage to address its objectives. Indeed, in today's events, we're hopeful that building upon that heart-shared foundation and leveraging resources like TopMed and Biodata Catalyst, this AMP program can really advance the field and again move us closer to having a greater impact on patients suffering with heart failure with preserved ejection fraction in ways that we hope will transform how we approach, diagnose, treat, and hopefully prevent heart failure with preserved ejection fraction into the future in ways that we think, again, will have transformative impact related to this AMP. And so, again, we're grateful for the leadership of NIH, our industry partners, and all those around the table that will make this possible, and appreciate your lending the brain trust that's assembled here in helping us solve this complex problem. Thank you, and best wishes for what will be a truly exciting program of meetings, as well as the future of this AMP. Thanks.